So in our fifth and final section, we will discuss the castrate metastatic disease. What is castrate metastatic disease? Chemotherapy and new agents for the castrate metastatic disease, and the pain management of the castrate metastatic disease. Castration-resistant prostate cancer is defined as, so it's castration-resistant prostate cancer as a disease that progress despite the androgen suppression by medical or surgical therapies, where the Mayer level of testosterone are 50 nanogram per ml or lower. So despite these levels, they are castration-resistant prostate cancer. There is rise in prostate-specific antigen continued signaling through androgen receptor signaling axis. Oncogenic changes, oncogenes are cancerous changes, overexpression of androgen biosynthetic enzymes, increase intratumoral androgens, overexpression of the receptors. So, majority of castration-resistant prostate cancer cases are not hormone refractory. The rise in prostate-specific antigen with no change in radiographs, no new symptoms, progression in bone with or without symptoms, soft tissue disease again with or without osseous metastasis, and there is visceral spread. So it's a metastatic disease, it's a castration-resistant prostate cancer. They are not hormone refractory, and there is no change in radiographs, no new symptoms present. There is progression in bone with or without symptoms. You can see the progress in the bone, very, very clear changes in the bones, density of the bone with the involvement or spread of the cancer to the bone. There are also soft tissue changes again with or without the osseous metastasis. Visceral spread. Some chemotherapy and new agents used. We have docetaxel, which is a systemic therapy. Sipuleucel T, first biologic approach. Cabazitaxel, non-cross-resistant taxane. CYP17 inhibitor, abiraterone acetate, which lowers the androgen level. Next generation anti-androgen like enzalutamide. Bone-targeted agents like bisphosphonates and rank ligand inhibitors like denosumab. So all these are the new agents that can be used for the castration-resistant prostate cancers. Abiraterone acetate and enzalutamide are first approved for post-chemotherapy. Pain management, secondary to osseous. So bone pain is secondary to the spread of the prostate cancer to the bones that can cause the bone pain, decrease the density of the bone, more clinical fractures occur. So this is associated with the spread of the cancer to the bone. Optimal palliation therapy is used to make the life of the patient better, to relieve the pain associated with the osseous metastasis. External beam radiation, assessment of symptoms, whether from metastatic disease or spinal cord disorders. Bone-seeking radioisotopes alpha retin and beta emitter 153 SMEDTMP quadramet. So these are the radioisotopes can be used. So that was all about the fifth section, and that conclude our topic, the treatment of prostate cancer. Thank you for watching sqadia.com.